We're going to discuss putting all of this together in order to complete our assessment. A medication assessment can be comprehensive, such as when you are interviewing a brand new patient in your pharmacy and reviewing all of their drug therapy. Or it can be a focused assessment in which you are performing a medication assessment on a specific disease state or a specific drug therapy. Generally, there are two components: the gathering of information, which we've already covered, and then the clinical decision making based on the interpretation of that information. This is otherwise known as the pharmacotherapy workup, which some of you may already be familiar with. It's a systematic process of evaluating a patient's health and medication information to identify drug therapy problems. It systematically allows you to evaluate the appropriateness of indication, determine drug therapy effectiveness, the safety of the regimen, and to ensure patient adherence or compliance. This is the process by which we create the drug therapy problem statements many of you have been exposed to in your previous pharmacy training. This diagram summarizes the assessment of drug therapy and where all of these pieces of information that we gathered in our health and medication history can be used to identify various drug therapy problems related to one of the four pillars of assessment. They are indication, effectiveness, safety, and adherence. Each medication therapy should be assessed in this manner and in this particular order. By assessing drug therapy in this manner, for indication, effectiveness, safety, and adherence, you are able then to identify one of the 7 drug therapy problem categories, which correspond to one of those pillars. The reason drug therapy is assessed in this order is quite logical. If a medication is not indicated, then there is no need to assess its effectiveness, safety, or the patient's adherence. Or, if a medication is indicated but not effective, there wouldn't be a need to assess the safety, since the drug therapy needs to be changed or the dosage increased. We're next going to talk briefly about care plan development. The purpose of the care plan is to help determine with the patient how to manage their medical conditions with medications. Components include the establishment of goals of therapy, determining the appropriate interventions, and then scheduling a monitoring and follow-up plan. The interventions listed here are not mutually exclusive, but can be divided into these 3 general categories. The interventions can be implemented to resolve drug therapy problems, achieve goals of therapy, and to prevent further drug therapy problems. You will get quite a bit of practice developing care plans within the pharmacotherapy courses in this program. Your monitoring and follow-up plan should take into account what should be monitored and when, and how often. Also, who will be responsible for this aspect of follow-up? Will it be yourself, the patient, or another healthcare provider? In follow-up evaluation, for each drug therapy, you repeat the process, assuming you have already determined that the drug is indicated. So you'll be continuing to evaluate the effectiveness, safety, and adherence to determine if any new drug therapy problems have arisen. Documentation is a skill that is becoming more and more important for us as professionals, since it is a record of the care that we provide to our patients. Documentation is an essential step in the patient care process. It's a communication tool and a permanent record of the care provided. It also helps to support our role in providing care and our role in medication therapy management. It can also be required for reimbursement of pharmacy services. There are a few types of documentation styles, including unstructured or semi-structured notes. Some software systems have more of a systematic documentation system as well. You will use a form of documentation that is conducive to your practice setting and that is useful for you and your team members who will be reading the notes in the future. Regardless of the type of format, there are some general principles that should be followed when you are documenting your patient care activities. The suggested information is listed here, but the level of detail will vary depending on the context or purpose of the encounter you had with the patient. You may not need to apply all of these principles all of the time depending on the situation. Some other principles recommended for your documentation can be the 5 C's. First, it should be correct, so an accurate account of the encounter that you have with the patient. It should also be complete, meaning that there was a thorough, detailed account of that interaction, while remaining concise. It should also be consistent, meaning that it is not self-contradictory. So the note should actually have the plan, which jives with your assessment, which jives with the information or the data that you gathered. Finally, your note should be cautious, which means that the actual care provided is the most logical choice from among the best alternatives to best serve the patient. The general structure of the note should include the information here and should have a logical organization or flow. For example, at the faculty here, we teach the Data Assessment Plan, or DAP format for documentation, but there are other types which are just as effective. To summarize, since this course will focus on assessment, this first series of podcasts covered the patient care process with an emphasis on assessment, and the care plan and documentation will also be covered extensively in a more practical manner during the pharmacotherapy courses and on your experiential placements.